San Diego County is ready to move to accelerated stage 2.
Health officials told county supervisors Tuesday that under revised state guidelines, they believe it's okay for restaurants to reopen for dine-in service with restrictions, and the same for in-person shopping for some retail stores.
This is a good plan. It's an aggressive plan.
Health officials made the recommendation based on factors like lower rates of positive cases, increased testing capacity, and the ability of hospitals to increase bed space. But some of the county's largest healthcare systems aren't unified on the plan to reopen further. Sharp Healthcare says triggers for adjusting the plan specifically as it relates to hospital capacity are not appropriate. Scripps healthcare officials are urging caution, warning that we only have a partial success story here. They're concerned about rising cases in the South County and Imperial County and the uncertainty of the supply chain. But UC San Diego Health and Palomar Health officials said after reviewing the plan, they support the county moving forward with reopening more businesses. The state is now reviewing the county's plan to ease restrictions. If approved, some businesses could reopen as early as tomorrow.
We remain committed to abiding by the state's order, but we also believe San Diego County is uniquely qualified to conduct a pilot program of some sectors reserved for stage 3.
The board also approved sending a pilot program to the state that would allow for the reopening of things like gyms, salons, research labs, youth sport clubs, pools, and outdoor religious services.
Given that we have not yet even implemented stage 2, I don't believe it's the time to call on the state to immediately allow us to go into stage 3.
Supervisor Nathan Fletcher was the only one opposed to the pilot program. County staff said last night they briefed state officials about the program.
And although they did not embrace it fully, they indicated a willingness to at least review our proposal.
Supervisors are also distributing hundreds of millions of dollars in federal CARES Act money. $275 million is going to the county's COVID-19 response, which includes testing and tracing efforts. $25 million has been set aside to help cities that have been seeing revenues drying up. $17 million is for stimulus programs for struggling restaurants and businesses, and $15 million is for additional behavioral health services. Matt Hofman, KPBS News.